Yes.
Diagnosis by 8 fundamentals, true and false cold heat syndromes. In certain serious diseases, when the illness has reached a critical stage of extreme cold or extreme heat, there may appear symptoms that appear to be opposite of the nature of the illness. Thus, a cold illness may, in such circumstances, present symptoms of hotness, and a heat illness symptoms of coldness. These are known as extreme cold resembles heat and extreme heat resembles cold. They are also known as true cold false heat and true heat false cold. True cold, false heat. This means that there is true cold in the interior, but symptoms of hotness in the exterior. Typically, the apparent symptoms are fever, superficial redness on the face, thirst, and a large pulse. They seem to suggest heat, but further observation shows that though feverish, the patient prefers warmth. Though the face is red, it is tender and the redness fluctuates. Though thirsty, the patient prefers warm drinks. And though the pulse is large, it is deep and forceless. Moreover, the forelimbs are cold, the urine is clear and copious, the feces are loose, and the tongue is pale with white coating. Symptoms of cold in the interior. Thus, the symptoms of hotness are false, and the nature of the illness is of yang deficiency and yin excess. This situation is one of strong interior in cold, pushing the deficient yang to the exterior. Hence, it is also known as the syndrome of excess yin expelling yang. True heat, false cold. This means that there is true heat in the interior, but symptoms of coldness in the exterior. Typically, the symptoms of coldness are cold intolerance, cold hands and feet, diarrhea, black tongue, coating, and a deep pulse. These seem to suggest cold, but further observation shows that though cold, the patient avoids warmth and the chest and abdomen are feverish. Though there is diarrhea, the feces have a fetid odor and are partly dry. And though the pulse is deep, it is forceful. Moreover, the throat is dry and there is halitosis. The patient is thirsty and prefers cold drinks. The tongue is red or crimson and the urine is scanty and dark. Sometimes there may even be mental confusion and delirium. Thus, the symptoms of coldness are false cold and the nature of the illness is of interior heat. The main mechanism is strong heat in the interior, trapping yang qi internally so that it cannot reach the limbs. Alternately, yang qi is excessive in the interior and pushes yin to the exterior. Hence, it is also known as the syndrome of excess yang expelling yin. In ascertaining the trueness and falsity of cold heat, it is necessary first to understand the entire course of the illness. In true cold with false heat, the illness usually begins with cold and only subsequently produces hotness. In true heat with false cold, the illness usually begins with heat and only subsequently produces coldness. Also, the apparent and false symptoms tend to reside in the limbs, the skin, or the complexion, whereas the changes in the visceral organs, chi and blood, and the fluids are what reflect the true nature of the illness. Hence, in the process of differential diagnosis, it is important to rely on the symptoms of the interior, the appearance of the tongue, and the pulse profile as the principal basis. Moreover, the apparent and false symptoms are not identical with their corresponding true symptoms. Consider the symptom of red face, for example. In true heat, the entire face is red, whereas in false heat, the redness is limited to the cheeks, and the red is superficial and intermittent. For the symptom of cold limbs, in true cold, the patient tends to lie in a curled up posture and desires to be covered, whereas in false cold, the chest and abdomen are feverish and the patient refuses to be covered. Thank you for your attention.